Hey everyone, this is Tyler. I'm on the road this week and giving this video from the conference room from the hotel that I'm staying at. So if you do hear any background noises or if I get disrupted, please disregard that and I'll try to edit the video later. Today I want to talk about the different physical therapy interventions that we can use. I think the module gives a good description of various techniques that we can use and gives a good context of how they can be used. But today I'm going to present how I think of different interventions. And I tend to classify things in my mind based on the codes that we use for billing. That's something that I've used, I felt has translated well across different settings, whether it's been outpatient or time that I spent in a skilled nursing center or in my clinicals at a inpatient rehab or acute care setting. And the types of billing codes that we can do or the interventions, I'm just going to list them off, then I'll talk about each one. So they're going to be therapeutic exercise, therapeutic activities, neuromuscular reeducation, gait training, manual therapy, aquatic therapy, group therapy, and modalities. I'm going to go through the first few quite heavily, and then the last few I'll give a more basic definition. So the first one, and probably the biggest one for physical therapists, is going to be therapeutic exercise. And for therapeutic exercise, I think of it as generally range of motion, flexibility, strengthening. So if I'm passively stretching someone's shoulder, or if they're assisted with the range of motion with a pulley system, that's going to be an exercise to gain motion of that joint. You can also think about therapeutic exercise as targeted stretching that I might give someone to impact a targeted tight muscle group, like a hamstring stretch or a piriformis stretch. And then strengthening can have different ways that I can strengthen muscle. So if someone has a pretty arthritic knee, I can have them do like less repetitions but longer hold time, so there's less constant movement of the joint. And if it's someone else that's not bothered by that joint uh, kind of arthritis, and um, then I can have them do more of a traditional strengthening. I can have them do more repetitions. I can have them do more resistance. I can have them do more endurance. And so strengthening is going to be a big part of that therapeutic exercise, whether it's actual movement, isokinetic, or if we're using isometric, kind of a contraction against something like a pushing out into a wall or pushing out into my hand. Therapeutic activities, that's another big one for me. For me, I think of therapeutic activities as big picture. So we're looking at targeting specific movements or specific points of something that they're going to do for a day-to-day activity. So I think of squatting, right? So if someone is having a hard time getting out of bed, that's essentially a squat, the lowest point of the squat, standing up. And so we might have them do some various sit to stands, different type of squatting. Um, Also, a big picture is going to be a lot of pushing, pulling, lifting, and whether it's kind of work conditioning to get back to a certain job, like lifting 50 pounds from floor to waist or 30 pounds from waist to shoulder, or having a person in the hospital or inpatient setting lifting a cup from waist height to their mouth, or shoulder height to overhead to put something away, training them to be able to do more tasks on their own. Therapeutic activities, you can also think about cardiopulmonary and endurance training, being able to get the endurance needed to complete a task, like being able to walk long enough to walk into a grocery store or stand long enough to do the dishes. And so we can use therapeutic activities both in an outpatient setting for kind of more of the sporting task or work related or daily tasks like yard work, or the inpatient setting, getting out of bed, rolling over in bed, being able to walk down the hallway in order so they can walk across their home, being able to go up and down one step to get into their house, or several steps to get into like an apartment or other complex that they may live in. Neuromuscular reeducation. I think of that as kind of balance training and also stimulating what we call neuroplasticity. So, neuroplasticity is going to be changing the structure of the brain. That's how we learn. Uh, for example, we learned how to write typically with our dominant hand, right? But we could, in theory, and we can learn to write with our non-dominant hand. And so this can be very important for someone who, for example, had a stroke. They have lost that ability to do that task. We're gonna have to retrain that, break down certain components of that task, and allow the brain to reform those connections. And we there's a couple other ways that we can do that, like PNF patterns, things like that, and the module is going to go into more in depth talking about that. For neuromuscular balance training, tactile feedback of a muscle, getting them to appropriately write um, themselves, whether it's statically, just standing, or dynamically being able to correct themselves with movement or while they're moving. Pardon me. And then also that tactile feedback of muscle. If I'm kind of stimulate a muscle or trying to like put some pressure on that, really targeting a certain muscle like the outer hip muscle, trying to get them to use that and fire that for a certain exercise, like let's say laying on their side and raising their leg, that is a certain, to extent, a component of neuromuscular reeducation. I'm trying to train that specific muscle for them to use that in a certain task or an exercise. So I could define that as neuromuscular reeducation. Gait training, it's really big too. That's going to be looking at breaking down certain steps of the gait process. So if they're lacking that initial heel strike or they're not getting that full push off, giving them verbal feedback, visual feedback, tactile feedback to complete that task. It's very common in the outpatient setting or inpatient after surgery. Um, for more heavy inpatient settings, they might use a local mat, which is a kind of robotic type of harness that they're going to have on the lower body, potentially upper body too, physically helping them walk. It might also have some kind of pads to stimulate muscle activation during key cycles of walking. There's also various harness systems that can be utilized to help support someone's body weight. That's going to be utilized a lot in inpatient settings. And some outpatient settings will also have a treadmill harness that you can use to help someone throughout the gait cycle and retrain uh, a better walking pattern. Manual therapy, that's going to be the last kind of biggie as far as interventions. Soft tissue mobilization or massage of certain muscle groups, myofascial release, might be using some trigger point release. Joint mobilization is also a good example. It's physically moving a joint. For example, if I'm trying to get a certain aspect of finger movement, I might physically try to isolate that joint, do some oscillations in the direction that I want the bone and the joint to move. Um, scar tissue mobilization. Once the scar is healed, I'm going to try to get that cross fiber movement, trying to get that scar moving to break up some restrictions of that area. We can also use some external interventions like cupping, trying to get some tissue moving that way. Might use Graston tools or instrument assisted soft tissue mobilization. We can do dry needling in certain states, which is very similar to acupuncture for a targeted muscle. And then also I would classify the wound management, debridement, that direct intervention can also be a component of manual therapy. The last few, group therapy. I've never done group therapy. I know that was a bigger thing, I think, in the past, and I've heard about it when I was in the inpatient rehab setting as a student. That's going to have two or more patients at the same time, and it doesn't include one-on-one time for each of the participants. So you might have a maybe five people sitting in chairs, and they might be all going through that same kind of group exercise class. Aquatic therapy, that's going to be using pool or water to use buoyancy to your advantage, take pressure off a certain joint, or if someone's having a really hard time walking, getting some pressure off. Um, Also using some of the resistance of water, moving in water as a form of strengthening as well. Last one's going to be modalities, using hot or cold, ultrasound, TENS or IFC, and some other things like traction to mainly reduce pain and get someone feeling better, so that way you can have them explore more options and um, start to tolerate more forms of treatment. So, hope that was helpful. If you do have any questions, feel free to leave a comment in our discussion. There is a Q&A discussion up now. Um, Feel free to leave a post in that or reach out to me by email. Thank you and have a good day.